Hi everyone, my name is Jenny Anderson and I'm here today from radiantandthriving.com, and we're going to talk today about gut health and how and why it is so important to your overall health. This is an issue that's very near and dear to my heart, and that would be because I personally had some very serious gut issues that I went through about 5 or 6 years ago. I was diagnosed with ulcerative colitis, and I had many other issues going on as well, including chronic pain. And truly, being a nurse, my experience goes back 13 years. I've been doing pediatric nursing, and I remember in my nursing training talking about conditions like ulcerative colitis, and basically the extent that I knew of this type of issue was that the treatment was really pharmaceutical, and that was it. There was really never any talk of diet or diet changes or anything like that. Now, I'm definitely aware that not everyone out there has ulcerative colitis or Crohn's or celiac or any of those more serious issues. But I want you to know that if you have any gut issues at all, it's really something to pay attention to, because you may not realize that those issues that you're having could be causing more widespread problems in your body that you're dealing with. So we're going to talk a little bit about what that looks like and how to correct those issues. I'm going to be looking off to the side a little bit because there's a lot of information to cover, and I want to make sure I don't miss anything, so I've got a little presentation I'm following. So what is the role of the gut? Even as a nurse, honestly, I was fairly unaware of some of the basics of the role of our gut, or otherwise known as the digestive tract. So in a nutshell, what does the gut do? It digests food, of course. It also regulates hormones, excretes toxins, produces vitamins and healing compounds, and of course, it's responsible for the absorption of nutrients. Inside your whole entire gut layer, so we're talking about our mouth to the exit point, which is it's a very extensive tube that runs through our body, and it twists and turns, and it covers a lot of surface area. If you opened the whole thing up, it would cover the surface area of a whole entire tennis court. And so inside that tube, there's a layer that is one cell layer thick, and it is called the gut-associated lymphoid tissue. Again, it's one cell thick, and it covers our entire GI tract. It's a protective layer, and its role is to make sure that everything we eat stays inside the GI tract and does not get into our bloodstream, but then it allows nutrients through to our bloodstream that we do need. So the food is broken down to the nutrient level, and it will be like a gatekeeper in order to allow the nutrients we need into our body, but keep particles of food out of our bloodstream that we don't want there. So it's really plays an important role. And those cells have little tight junctions that hold them together, so that each cell, if you imagine my palms are a cell and my fingers are the tight junctions, those tight junctions hold those cells together so that it can perform, so that that layer can perform its role that it's supposed to be playing. However, if that layer is damaged, we can then develop food allergies. This will cause an overactive immune system, leading to inflammation that spreads through the body. So you can imagine if food particles are allowed through those tight junctions, which may not be so tight anymore, you've got those food particles floating around in your bloodstream, which causes inflammation, and your immune system recognizes it as foreign, so it starts attacking it. This is why reactions to food often do not manifest as gut issues, but in fact any type of reaction at all. It could be a rash, headache, migraine, brain fog, nasal or sinus infection, and even UTIs, believe it or not. And that's just a few symptoms that can be present when you've got damage to that layer in your gut. And so we're going to call that leaky gut syndrome. You may have heard of this before. I remember the first time I heard of it, I thought, there's no way I have that. That is not me, even though I had horrible gut problems. It just sounded so strange and I just didn't get it. So leaky gut is really when there's damage to that protective layer and those tight junctions that hold the cells together become loose, and it allows particles of fluid out of your gut and into your bloodstream. The role of the gut continued. We've got that one-celled thick layer. We've also got gut bacteria going on in our gut, which should be healthy functioning. A healthy functioning gut should contain trillions of friendly bacteria, which play a big role in the absorption of nutrients, in the regulation of the immune system, and even in the regulation of hormones. So that friendly bacteria is incredibly important to our gut health. According to Chris Kresser, one of my favorites, gut dysbiosis, which is when your gut bacteria becomes less friendly and more harmful. Gut dysbiosis is linked to estrogen-related diseases, and I wanted to mention that because a lot of our audience does include women, and I just wanted to point out how important your gut health is to every issue. So, for example, if an estrogen-related disease is present, it could be endometriosis, PCOS, which is polycystic ovarian syndrome, and even lead to breast cancers and cancers of the reproductive system. So I just kind of wanted to point out how extensive the problems are that can be related to gut problems. And that is one in particular that's related to gut dysbiosis, which again is when your friendly gut bacteria becomes less and pathogenic bacteria starts to take over. Also inside our gut, this is very much worth mentioning, we have a lot of neurotransmitters. And in fact, there are more neurotransmitters in the gut than there are in the brain. So you can imagine if the gut is not functioning properly, your nervous system may then be affected. You may have symptoms like anxiety and depression. So that's a very important part of the gut as well, the enteric nervous system. Finally, a healthy and well-functioning gut plays a really big role in the elimination of toxins. And that may be kind of obvious, but the GI tract does include the liver, which filters out toxins and then sends them to the colon to be eliminated from the body. And if your gut is not functioning properly, then this process will not work as well. So that's a little bit about the role of the gut. How then does the gut get out of balance? And we talked a little bit about leaky gut syndrome, but what causes leaky gut syndrome? So we're going to really look at diet as one of the big factors here, but there's a few other factors as well. Obviously, a processed diet, which is low in nutrients and high in sugar, can alter gut health. And the way it does that is it actually feeds the pathogenic bacteria rather than the good bacteria. One example is that fast food actually feeds the bacteria that increases food absorption. So if you're trying to lose weight, that fast food is not going to be your friend because it feeds that bacteria that will increase the amount of food you're absorbing. So that's not going to work in your favor. Another issue is the overuse of gut-damaging medications such as NSAIDs, and that will include your anti-inflammatories such as Tylenol, ibuprofen, Aleve, things like that. There's a place for those, of course, but if you're using those on an ongoing basis, it is going to damage that one-celled thick layer in your gut, so the gut layer. Acid blockers are another one. Antibiotics, steroids, and hormones. All of these medications can damage your gut layer. Some of them also can alter the gut flora in your gut. So there's a little bit of both going on. And for me personally, before I got diagnosed with ulcerative colitis, I had been taking a high dose of Aleve for 6 weeks. And this was because I was pretty desperate about some chronic pain that I was having, and my primary care physician suggested I try the Aleve. It helped mildly with my pain, but it truly, I think, was the straw that broke the camel's back and sent me into the tailspin of gut problems that I started to have. So that was a little bit of my own experience with medications that can alter the gut. I know also when I was younger, I was on long-term antibiotics for acne, and that went on for years, and I'm sure that did not do my gut any favors as far as the gut bacteria that I had going on. So those are some experiences I had myself with medications. Okay, so we're going to keep going. We talked about fast food. We talked about medications. Another thing that can cause damage to the gut is undetected food intolerances. So if you're reacting to gluten, dairy, soy, sugar, those are all very common. Those are all very harsh for the gut. And gluten in particular is something that has changed over the years, and many of us are having issues with gluten these days. Okay, so on to the next. Toxins like mercury can cause imbalance of gut flora. Mercury is found in our silver fillings that some of us may have in our teeth, but there are other toxins such as aluminum and even other things that can cause damage to our gut lining. Impaired digestive enzyme function can also cause difficulty in digesting our food. So then the food particles aren't getting broken down and are causing more irritation to the gut than they should be. And finally, of course, stress is going to alter gut health and the immune system. And that can really lower our defenses and cause some of those previous issues that I talked about to affect us even more. So that's a little bit about how gut problems can come about, what causes them. So how then can we optimize our gut health? We need to know how to fix it, right? So number one, it starts with a whole foods diet. We need to focus on unprocessed foods, plenty of fiber from veggies, fruits, seeds, nuts. You've probably heard this before, but you want to shop the periphery of the grocery store because the periphery is where all the fresh foods are. So we want to focus on those foods. You need to identify any food allergens and eliminate those for a while or maybe forever. You can identify those allergies by getting IgG food allergy testing. This can be done through a naturopath or a functional medicine provider. It's a blood test that identifies any food that you might be reacting to. And then you can also do an elimination diet. So the way you would go about this is you would eliminate wheat, dairy, soy, sugar, and possibly eggs for at least 30 days and add them in one by one to see what the reaction is. I want to add that if you are having serious gut issues, such as what I had, ulcerative colitis or Crohn's or celiac or a severe IBS, then you may need more than just to eliminate those things that I mentioned. You may need to focus on a gut-specific healing diet, such as specific carbohydrate diet or GAPS, SCD or GAPS. I personally followed SCD and found great success with it. So I just wanted to throw that in there. If your gut problems are severe, then you will want to check into a little bit more of an intensive healing program. But truly, the basis of good nutrition is going to start with a whole foods diet and eliminating food allergens. What else can we do? Well, I mentioned gut dysbiosis, which is, again, when the good friendly bacteria kind of get pushed down and destroyed in our gut, and the pathogenic bacteria then begins to take over. So what we can do there is there are supplements. Jessica Parker can help you with this, and you're welcome to ask any questions you want. I'm going to talk about a lot of supplements actually, and so I'm not going to get into a lot of specifics, but I will let those questions come, and Jessica or myself can answer them. You can get GI cleansing formulas. Oregano and thyme and black pepper are and clove actually are some herbs that can help to decrease the bad pathogens in your gut. So basically what herbs like this do is they create an unfriendly environment against potential threats that can disrupt our gut. So those threats typically being pathogenic bacteria, sometimes parasites even can be an issue, especially with people with severe gut issues. So something like that can help. Often for a typical case, you would use something like that for 10 days as a cleanse. But for someone with parasites or more serious issues, you would need to work with your doctor on probably doing a cleanse a little bit longer than that. So correcting gut dysbiosis by taking something to decrease the pathogenic issues that are going on. Then you'll want to take probiotics and also eat fermented foods. Fermented foods are ideal, truly. Something like homemade yogurt, and that would be yogurt that's been fermented for 24 hours or longer. And you might be asking by now, at this point, why would I suggest dairy when I previously mentioned that you might want to cut dairy out? Well, something like fermented yogurt that's, again, fermented for 24 hours has no lactose in it and contains trillions of good probiotics and can be very healing for the gut. Now, if you're pretty sure you have an issue with dairy, then consider making your yogurt with goat's milk instead of cow's milk, as that is much better tolerated. It's a different type of casein protein. Raw sauerkraut is another great option, and raw kombucha. However, a lot of people find it difficult to get those things into their diet every single day, which is really what you should be doing. And so you can fill the gaps by taking a probiotic. Try to find something that has 10 to 15 different probiotic strains. I would prefer that it has at least 30 billion CFUs per capsule or per serving, and really up to 100 billion CFUs or even higher, I've seen, can be very helpful in a probiotic. Find something that also contains prebiotics if possible. Prebiotics are what feeds the probiotics so that they can proliferate in your gut. And then it's also helpful with a probiotic if it has a protective coating on the capsule that does not release in the stomach, but rather releases in the small intestines and colon. And again, this is something that we can talk further about if you have questions about specific supplements. When do we take a probiotic? Personally, I like to take probiotics at night, right before I go to bed. You can also take it with meals, especially if it has that protective coating. So it just depends on when it works for you. Another supplement that can really help with gut healing is digestive enzymes. And I mentioned previously that a lack of digestive enzymes can contribute to gut problems, and that is absolutely true. Our food is more and more devoid of digestive enzymes. So if you think about raw foods, many of them contain enzymes. And even like raw milk has lactase in it to help you digest the lactose that's in the milk. And many of us don't drink raw milk anymore. So we have issues with digesting milk for that reason. So other foods are the same way. They've got enzymes that help us to digest. We also make our own digestive enzymes in the pancreas, but as we get older, our production of these digestive enzymes does decrease, as well as they do decrease when our gut health becomes poor. So you can help this issue by eating raw foods at the beginning of the meal and foods like raw sauerkraut and kombucha because these do contain enzymes. However, they do not contain every enzyme that we need in order to digest our food. Protease is one example of a digestive enzyme that's very important for breaking down protein. And you're not going to find protease in any raw foods. So we can help that issue by taking a digestive enzyme. You want to look for a digestive enzyme that has high amounts of protease. Some of them have an array of digestive enzymes, but the protease is low. And so you want to find something that is high. I will give an example of this. Enzymatica Digest Gold is one. And then Terrazyme from doTERRA is another great digestive enzyme product. Many people benefit from taking 1 or 2 of these capsules per meal. When I was really into the most intense part of my gut healing, I was taking 2 digestive enzymes per meal, and that was really helping me. Now I can do less because my gut health is better and I'm producing more enzymes myself, but I still take them every day, and I'll take 1 to 2 per meal. In fact, with digestive enzymes, because you're taking them and breaking down your food even better, you decrease your chance of developing further food allergies. And this is because, again, when you're trying to heal leaky gut, those tight junctions, when it still is not quite fully healed, some of those larger food particles escape out into our bloodstream and can cause reactions to those foods. So if you're fully breaking down your food, you're going to have less chance of that happening. Another supplement that can really help with gut healing is betaine HCl. And this is basically a hydrochloric acid supplement. Hydrochloric acid is indeed your stomach acid. And I know we associate that with reflux and, discomfort, heartburn. However, stomach acid, people may not realize, is so important for digestion. It is your first, I guess, beyond your saliva, it is the first thing that starts breaking down your food. So, number 1, that's incredibly important. Again, breaking down our food. In addition, it's our first line of defense against any pathogens that come our way. It creates an unfriendly environment for pathogens to proliferate. So if we're taking a proton pump inhibitor, like an acid reducer, and we're lowering our stomach acid more, that does set us up for not digesting our food well, and also it opens up the door for developing any pathogens that might be going on, any gut infections that can occur. And many people don't realize as well that reflux is usually due to low stomach acid to begin with, not too much stomach acid as we've kind of been trained to think. The reason for this is if you imagine the stomach as a balloon, when we have the proper amount of hydrochloric acid, the stomach will be nice and round like a balloon, and it won't be deflated. So that esophageal sphincter at the top will help to keep the stomach acid where it belongs. If you have too little stomach acid, your stomach becomes kind of deflated, and it then relaxes the esophageal sphincter and causes the acid to leak out into our esophagus, if that makes sense. So with the low stomach acid, we need to correct that. Sometimes the low stomach acid occurs because your gut health is poor. Sometimes it's because you've taken too many proton pump inhibitors. Whatever the case, we need to correct that. So if you think you may have this issue, then you can supplement with betaine HCl. This is a pretty inexpensive supplement, and the way you do it is with each meal you start with 1 capsule that you take at the beginning of the meal. If you tolerate that well, then the next day take 2 capsules, and so on and so forth, until some people get up to 4 and even 5 capsules per meal. This will not last forever, but it will help you to build your levels back up of HCl, and eventually you can wean back down. Now you're going to keep adding capsules until you start getting that heartburn feeling. And, if that happens to be 5 capsules that gives you that feeling, then you will back down to 4 capsules, and that will be your dose to take with any big meal. It doesn't have to be with snacks. So betaine HCl can be very helpful, and some people find just immense relief after taking it. Gut strengthening supplements include zinc, magnesium, collagen protein. That would need to be grass-fed and pasture-raised. So those 3 can be very helpful in building your gut back up. Vitamin D3 is important to mention because many people with ongoing gut issues are going to have low levels of vitamin D. So restoring those D levels can help with all overall healing. L-glutamine is a supplement that is specific for healing of the small intestine. And then butyric acid is specific in healing the colon. Interestingly, as a side note, butyric acid is something that you would gain if you're drinking a real Bulletproof coffee. So that's a coffee that has organic or Bulletproof brand coffee. And you add collagen protein and probably like an MCT oil and also grass-fed butter. The grass-fed butter unlocks butyric acid, which is in the coffee, and then provides a natural source of butyric acid, which is really incredibly helpful in healing the colon. So that's a side note that I found really fascinating. Another way you can support digestion is with essential oils. And this is a big part of my ongoing digestive support. I'll just mention briefly, there are digestive blends like Digest Zen. Other specific oils that are great for digestion would be peppermint, ginger, tarragon, and fennel. Some of these are warming, which helps get the GI tract moving, and that's so important for elimination. And some of them aid in digestion. I really like the digestive blend, Digest Zen, and I would just add 1 to 2 drops to your water, or you can take in an empty veggie capsule. You can also apply these oils externally to your abdomen, mix it with a little bit of fractionated coconut oil, and then add 1 or 2 drops and just rub all over your abdomen. Another one that I want to mention is frankincense because it's so wonderful at helping with inflammation. It's so anti-inflammatory. So that can help not only for your GI tract, but just overall for your whole system. Frankincense is wonderful. So one of my favorite things to do is to make a capsule. I will include 2 drops of Digest Zen blend, 1 drop of peppermint, 1 drop of ginger, and 1 drop of frankincense. And if you're having kind of an acute gut issue, this provides immense relief. If you're having ongoing issues, then it can help you on an ongoing basis with digestion and inflammation. So I really love to use essential oils to support my gut health. And then I want to talk about foods that are very specific to healing the gut. So we've talked about supplements, we've talked about, probiotics and including fermented foods to eat. And I do want to add that those fermented foods are very helpful in healing the gut. But as far as building that gut lining back up, the number 1 food I would recommend would be homemade bone broth. And you can make that with either chicken bones or beef bones. The beef marrow bones are the best for that. Most people find chicken broth to be a little more palatable than beef broth, but they're both really wonderful. And you can make the beef broth more palatable by adding something like a short rib while you're simmering your bone broth. And it can be actually really excellent when you're making a soup out of it. So homemade bone broth, number 1, is really good for rebuilding that gut lining and healing leaky gut. Healthy fats are also incredibly important in healing the gut. I am sure if you have followed Jessica for any length of time, you will know that Jessica is a big proponent of healthy fats, and it is no longer accepted that a low-fat diet is healthy. It is not good for us. It's not good for our guts. It's not good for our hormones. It's just not good for our overall health. So you make sure that you include lots of healthy fats into your diet. Good examples of these would be coconut oil, fish oil, avocados, pasture-raised butter or ghee, all of those are wonderful at supporting gut health. Again, if your gut is severely damaged, I just want to add again that you should really consider something like specific carbohydrate or GAPS diet, as that will take that gut healing to the next level. All right, so I hope that this has helped you to understand why healing the gut is the basis of good health. I hope you can understand now why, when you have leaky gut, that our issues that we experience are not limited to the gut, but they can be completely system-wide in our body. Now, healing your gut may not solve every single issue that you have, but it provides the foundation that you need to jumpstart any issue. Now, if you're doing gut healing for any length of time and you do see improvement, but you're not getting to the point that you need to be at, then you might consider a couple other things. And the main three things that I want to just mention, if you're someone who is really struggling with your health, consider gut infections. I briefly mentioned that before. Gut infections like H. pylori or parasites or candida can definitely contribute to ongoing health issues, even if you're eating a really good gut healing diet. Just remember that the diet alone won't kill some of those pathogens, so those will need to be addressed. Second is hormone imbalances. Most of us will have some hormone imbalances if we have any ongoing inflammation for any length of time. A lot of times that will correct itself as we heal the gut, but sometimes we need to do a little bit more to correct those hormone imbalances. And specific to that would be correcting adrenal fatigue. So I won't get too much into that, but I just want to mention it. The third issue that can contribute to ongoing health problems despite gut healing would be detoxification issues, and that would be specific to the methylation cycle in the body. And I won't dive into that too much, but it's something to consider. And if you've heard of the testing like 23andMe, that's where you'd find that information if you have those ongoing issues. So I hope you found this very helpful. Please feel free to post any questions or check in with Jessica if you need any help with any specific supplements. I am happy to help with that as well. Thank you so much for being here and have a great day.